all 32 councils within Scotland. Delighted that so many people could join us here today. Delighted that we've got the expert panel with us as well, who I know you will ask questions. I know they will be challenging questions, but the panel are ready and up for that. And that's very much what these sessions are about, making sure that you do get the chance to put your questions and hear the understanding and the thinking behind, obviously, what we're all experiencing at the moment and the decisions that are being made. So it is key that you do ask those questions. One thing I would just highlight that Stephanie has said, obviously we're going to make sure that this is available for others who aren't able to join us today. So when that does become available, we would welcome that being shared so that other colleagues can obviously benefit from the discussion that we're about to have. Without further ado then, I'll introduce our panel that we've got today. Delighted that we've got Professor Carol Tannahill, who is the Chief Social Policy Advisor for the Scottish Government. Professor Tannahill also chairs the Scientific Advisory Subgroup for the COVID-19 Education Recovery Group. Hereafter we'll refer to as SERG, although some people do call it Serge if you've got a French slang. So that's the group that we'll be mentioning. With Carol today, we've also got Elizabeth Morrison, who is Interim Deputy Director of Learning for the Scottish Government. Also delighted that we've got our colleague Dr Diane Stockton from Public Health Scotland, who is the Social and Systems Recovery Lead. We've also got Simon Mayer, who is from Scottish Government, and he is the Head of Delivery and Assurance in the Early Learning and Childcare Directorate. And not on the call with us as yet, but to join in a little while will be Dr Dave Caesar, who is the Interim Deputy Chief Medical Officer for Scotland. So you've got a vast array of experience and knowledge and expertise on the call with you today. Each of the individuals involved are involved not only in the recovery work that's going on, but also the scientific subgroup work that is going on as well. So I couldn't have a better panel for you. On that basis, without me taking up any more time, I'm going to pass across to Carol, who's going to take us through a quick presentation. Thank you.
Thanks, Simon, and thanks, Stephanie. It's just great to be with you all this afternoon, and fantastic to see so much interest in this session. I'm going to kick us off this afternoon with a short presentation. It will take 10 to 15 minutes, just providing an overview of some of the facts about where we are in the epidemic and some of the more recent evidence. And I hope that just provides a really helpful backdrop for the conversation. I have to say it's great to be doing this at the beginning of March, not only because I think we've all got a bit of a spring in our step, but also actually within these data you'll see there's a real scope for a degree of optimism, which is the first time for a few weeks that we've been able to present this sort of overview with optimism. So it feels really good to be doing that. So can I just check, Simon, that people can see my slides and can hear me? Are we all okay? I think you're on mute.
Yes, Carol, we can.
You're fine. Brilliant. Okay. In which case, I'll just kick off. So let's just move on. So just starting off, this slide shows us the number of COVID cases per day from when the epidemic started just a full year ago now, right up to last week. And you can see on these waves that we talk about, but most importantly, you can see that we're now reaching a stage where we're really coming down from that extreme peak in January down to a level that's comparable to where we were at the beginning of October. And today you might have heard the First Minister announce 542 new cases. Last Tuesday, a week ago, it was 655 cases. So we've got a sense that we're no longer even stagnating, that we are now beginning to see a very definite continued reduction in the epidemic. This just looks at the last part of that graph in a bit more detail, so going from September through to the present day. And what I want to draw your attention to is the rate per 100,000. And in Scotland, now that's significantly better. You can see in January we were up at about 300 cases per 100,000. So real significant improvement. However, WHO says that you need to have about 50 cases per 100,000 to show that the epidemic is moderately well controlled, and down to about 20 cases to show that you're working at a really low, well-controlled level of the epidemic. So though, as I say, things are definitely going in the right direction, we've still got a high incidence and prevalence rate, and we need to continue to act to suppress the epidemic. This slide shows the rates by age group in the population. And what you see here is that the prevalence is higher amongst the adult population than it is amongst the 0 to 19-year-olds, who have got the lowest incidence rates of all of the age groups. And Diane, who's on this session this afternoon, is the custodian of all of these data and analyses, and would be absolutely the right person to be able to tell you more about any of these age group differences, should you want to ask any questions about those. Moving on then to the R rate, this rate that we've heard so much about, and you can see that sort of throughout February, R has remained within the range of about 0.7 to 0.9. So it has remained below 1, which is fantastic news. You'll know that once it goes over 1, it means that the epidemic is increasing and will increase exponentially. So we're really committed to doing everything we can to keep R below 1. And it looks as though this range of 0.7 to 0.9 is probably about as low as we might get it with the new variant. The new variant has been an absolute game changer. And I'm just going to show you this slide, which gives us from the genomics an indication of the proportion of cases that are accountable from different variants over time. And you can see the mix in the first wave. In the second wave, it was a variant that came from Spain that became the dominant variant at that time. And then most recently, this green one emerged sort of towards the end of November in Kent. You'll know it as the Kent variant. And it's now accounting for the vast majority of cases in Scotland. About 85% of cases in Scotland are now from the Kent variant. We may well get onto this in discussion, but of course, everyone I think is aware that the emergence of new variants and recent cases, for example, of the Brazilian variant, just reminds us of how important it is that we've got really good testing and tracing, so that should new variants emerge, we can identify them quickly and follow up the contacts quickly and make sure that they don't spread. This shows it's a slightly complicated slide, but the colours that it's worth looking at in particular are the red line and the green line. And so the red line are the cases of the old variant, and you can see just how much they have fallen since January. The green line are the Kent variant, and you can see that it's much, much slower to decline over this period of time. This is because this variant is just much more transmissible, and it seems to be just much more infectious, so that if it gets anywhere, it's more likely to take off, and it's just much harder to suppress even through the lockdown that we've had. It's just much slower to decline. So as I say, this has been a real game changer in terms of our approach to controlling the epidemic. This slide shows the comparisons with the other UK nations. You can see Scotland in the kind of grey colour, England, Wales and Northern Ireland. Northern Ireland's doing better, if you like, than the other nations in terms of deaths. Scotland and England deaths now fairly comparable to each other. This is an international slide. I'm not sure how well you can see it, because it's quite a busy slide, but again, it shows you just internationally the range of different patterns, the way in which countries have all reached a peak and then have seen in recent weeks a decline and a gradual stagnation in their rates over time. Obviously, one of the ways in which we need to control the spread of the variant is by looking at the sorts of activities that people are undertaking that are associated with a positive test as a result. So this slide just summarises from our survey data and our COMIX data what activities people report undertaking in the 7 days prior to getting a positive test. And you can see, of course, shopping, something that, because the vast majority of the population do, shopping is associated with a positive test in about 30% of the cases, and over a fifth are associated with interactions in their own home or family home. So these are the two activities where we're seeing the greatest association with a positive test. This slide is from our modelling, which shows projections into the future. Everything I've shown you so far has been looking back in terms of what's happened. This is looking forward. The better line here, the kind of orange coloured line, shows what will happen when vaccine has its full effect. And the worst line is the sort of projection if vaccination doesn't progress or proves not to be as effective in terms of reducing transmission. And you can see that the modelling has, follows the cases here, but from the middle of February, we begin to recognise we're going to see an uptick in cases, both on the best case and on the worst case scenario. And this reflects the phase 1 return to primary school and early learning and childcare that took place on the 22nd of February. So we know that that is going to have an effect on the number of new infections, but it's looking as though that effect will be relatively small. I'm just coming to the end, but I just want to say a bit about vaccination, and when Dave Caesar joins us, he'll be able to tell you more about vaccination. But this slide just shows on the international comparison how well the UK is doing in terms of the share of people who have received at least one dose of vaccination. This is just for Scotland, and it reminds us that about 1.5 million people in Scotland have now received the first dose of vaccination. It's just an astonishing achievement, and huge thanks to everyone who's been involved in making sure that that has happened. I imagine there will be questions about the vaccination policy and the rationale for doing this purely based on age. And I think this slide is incredibly helpful in answering in that regard. This is from the Health Foundation, and it shows us that for the over 90-year-old population, for every 40 people that are vaccinated, 1 death is prevented. And you see a very clear stepwise gradient as you go for advancing age. And by 50 to 54-year-olds, you need to administer 40,000 vaccines to prevent 1 death. Compare 40 vaccines to 40,000 vaccines. Of course, this is a reflection that age is the primary risk factor for death from this virus. And in Scotland, we've made huge progress. This just shows by the JCVI priority groups that over 80s, 100% vaccinated, age 75 to 79, over 100% vaccinated, and of course, the focus on health and social care staff. So just pulling out some key points then from that overview. I hope I haven't gone too fast. I hope it's you've been able to follow it. But key conclusions I think that we would like to leave you with is that the number of cases are falling and are continuing to fall, but they do remain considerable. They're not yet at a level that WHO would say that we've got the pandemic controlled to a low level. And the R value, the transmission rate, is remaining at between 0.7 and 0.9. I haven't shown you actually data on hospital and ICU patients, but the pressure on the NHS is continuing to decrease, which is great news, and reported deaths have fallen by almost 20% over the past week. So really significant impact on deaths, partly associated with the vaccine, which again is just hugely encouraging. The new variant, the Kent variant, we call B117, is now absolutely the dominant variant in Scotland, and it's further increased in prevalence. It continues to dominate and become more prevalent in Scotland. We're also monitoring the other variants of concern, and I appreciate there may be some questions about other variants as well as we go through this afternoon. And lastly, the good news in vaccination, about 1.5 million people have now been vaccinated, and we're on track to meet the target for the priority groups. So I'll leave it there. I'll stop showing my screen and come back and look forward to the discussion and questions. Thanks very much.
Thank you very much for that helpful update. Like I said at the beginning, we have had an array of excellent questions, and I really want to thank the participants for submitting them. So I'm going to move straight into our question and answer portion of the session by inviting Sylvia Honey, if she would like to unmute her mic and direct her question towards Carol. Thank you.
Hi, the question that I would like to ask is Dr. Deepti Gurdasani disputes what Jason Leach had said, and that she states that young children are 3 times more likely to spread the virus. Why is this, if it could be explained? Thanks.
Thanks, Sylvia. So your voice cracked up a bit there, so I'll just repeat the question so that everyone on the call has it. So the question is about Dr. Deepti Gurdasani's comments about how transmissible the virus is, stating that young children are about 3 times more likely to spread the virus. And this is a different analysis to the one that Professor Jason Leach has communicated out to the system in Scotland. And I guess this is part of the joy of science, isn't it? That there's always a range of evidence, and there's always some studies that aren't in line with others. And there's a range of opinions about how to interpret the evidence. And I think that's absolutely what you're seeing here. I have to say, though, that Jason's position is much better reflection of the consensus position on this than Professor Gurdasani's position is. So overall, there is absolute consensus that younger people, particularly youngest children, are much less likely to transmit the virus, even with the new variant, than are older children and our adults. And that's the basis on which we have provided the advice we have in Scotland about the relative safety of early learning and childcare settings and primary settings compared to secondary school settings. That's why we think that there's need for greater mitigations in secondary school settings than there is in early learning childcare and primary settings. So there's been a number of reports that have come out and a number of consensus statements, most recently the consensus statement from the Department of Education and UK government, and again that re-emphasises that the youngest children are much less likely to transmit than the older children. Don't know if Diane wants to add anything to that, because again I know she's been looking at all of this and looking at it in the Scottish context too.
Yeah, no, completely support that, Carol, and a lot of work's obviously been done on this. And just this week, we've got real life data from Scotland where all of healthcare workers who live with children have been analysed to look at their risks of COVID. So people that live with children under 11 or under 12 in Scotland who are healthcare workers, and healthcare workers that don't live with children under the age of 12. And that's real. This is real life data from Scotland, and it shows the risks of getting COVID are lower for those healthcare workers who live with the children compared to others. So, there's a lot of different types of evidence and real evidence coming out of Scotland on that too.
Thank you both. That's helpful to have that clarity, actually, because that was a common question from the previous Blether as well. So thank you for that. If I could now bring in Leslie Ferguson, has a question around sort of face masks for Carol, and Elizabeth might want to contribute to that one as well. So Leslie Ferguson. Leslie, are you there? Sorry.
Can you hear me?
We can hear you now.
Oh. To mitigate risk, adults are being asked to wear face masks when visiting shops, etc., where we know social distancing is also in place and often in a much larger space. Why are staff then not being encouraged to do this when working in a smaller environment for a longer period of time and where social distancing is difficult? What is the advice around mask wearing within ELC settings? And also for the health and well-being for children, can transparent face coverings be provided for staff?
Great. So thanks, Leslie. I don't know, Elizabeth, do you want to kick off on this one, or do you want me to start?
Do you want to start, Carol, and I'll come in? I can maybe talk about transparent face coverings.
Perfect. Okay, that's great. Well, I'll start. So the advice in relation to face coverings should never really just be seen on its own. So the key thing to remember is that transmission is affected by the population involved, the environment in which they are, and the characteristics of the virus. Okay, so we know, as I've just said, that with this virus, and particularly this variant, transmission is much less likely by younger children than it is by adults. We also know that wearing face coverings is only one mitigation, and it becomes particularly important in environments where some of the other mitigations aren't possible. So in ELC settings, in primary schools, we're able to work much more in bubbles. We're able to have a really good sense of who's in touch with whom. We're able to have all sorts of controls about people not attending if they've got symptoms, or if they have got symptoms, being tested quickly and being, you know, advised to go home, taken home, etc., etc. So it's a much, much more controlled environment than a shop is, for example. And in that context, we, having looked at the evidence from a range of places, really felt that it was not necessary when adults were working closely with children for them to be wearing face coverings. Now, of course, when they're in contact with other adults, the risk is increased because the other adults are much more likely, again, to transmit the virus in that context. So where you're in contact with other adults, in whether it's at the school, in a school classroom or whatever, then it's important, in the staff room, then it's important that adults wear face coverings when they're interacting with other adults. But it's much less important when they're interacting with children and isn't necessary. And if you look across Europe, you see that different countries have got very different policies on all of this, but that generally, in terms of the primary setting and the nursery setting, the advice is that masks are not required in that setting because of the nature of the young population there and the much more controlled nature of the setting itself. So I hope that helps explain some of that. But over to Elizabeth to add to what I've said.
Thanks very much, Carol, and good afternoon, everybody. Really pleased to be here, and some great questions coming already, so thank you for that. I think it's important to recognise that the subgroup right from the very start said that anyone wishing to wear a face covering should be enabled to do so. And we chose that word very carefully because actually it's that if people feel they would like to wear a face covering, then they should be enabled to do so. And people should certainly not be stopped from wearing a face covering if they feel that they would like to. I think also in terms of the question about transparent face coverings, we know that some authorities have actually purchased transparent face coverings for some of their staff who are working in particular contexts. I've had mixed feedback. Some people say they really like them and other people say they really dislike them. So it's not a kind of everybody likes them or everybody dislikes them. It's very dependent on the individual. Some people like them, particularly when working with children who may be hearing impaired or younger children, and other people find them more uncomfortable than a cloth face covering and more difficult to use than a face covering. So as I say, there's mixed press in them. We know that, as I say, at least one authority has provided that for staff. We wouldn't necessarily expect authorities to provide that, although you'll be aware that Scottish Government has provided significant funds to each of the local authorities to support COVID changes in their schools and COVID recovery in general. It's probably also worth noting that some people thought that they could wear a face visor rather than a face covering, and we wouldn't recommend them because of the risks. So people might want to wear both, but we certainly wouldn't recommend just the face visor. Face covering is much safer. Thank you.
Thank you both for that. It was good to have clarification around the choice about wearing face masks in those contexts, and particularly the point about the visor as well, so thank you for that. We have a question now from Lorraine Barr. Could I invite Lorraine to come in with her question for Elizabeth, please? We got Lorraine with us? No? Okay, I can ask that on behalf of Lorraine then. So, Elizabeth, the question we've got here is, will whole establishment gatherings, such as Easter or Halloween parades, be a thing of the past now due to any potential transfer of any virus?
I think that's a really interesting question, and I think it's very difficult to actually see what the future might hold. What I think is very clear is that we're not going back to what we did normally before. Whatever changes are made, it's not going to be the same thing, and people are going to have to adapt. And I think one of the key messages in terms of vaccination at the moment is, just because somebody has had a vaccine doesn't mean they can do what they always did and go out and about and hug people and greet people and socialise. That actually, one, it takes some time for the vaccine to work, but also it's just we're not going back to that. I think that there are signs that some things eventually may happen, and one would hope that things like assemblies, like Halloween, like stuff around Christmas festivities that didn't happen this year will come back. But I think it's going to be time. I think it's also going to be looking really carefully at the prevalence of the virus, looking at the positivity. And I think it's going to be a long time before we get back to some of these activities. I think it's also going to be looking at which activities are going to be indoors and which are outdoors. So, for example, activities which are held outdoors, and I think the example was Halloween, where that's generally an outdoor activity, is generally always going to be safer than any indoor activities. So if it's an Easter parade outdoors, it's more likely to happen than an Easter parade indoors. But I don't see any Easter parades happening this year. But going forward, assemblies are such a vital part of life in a school or an early learning and childcare setting that one would very much hope that with time we could get back to these. And I think what's been absolutely fabulous is seeing some of the creative ways in which schools have done that, using some of the Teams technology, some of the other technology, where they've had the whole establishment participating in such events without actually gathering them together in the one space. Hopefully that answers that.
Yeah. Thank you so much.
I'd just add to that, and I mean, I think that the point about doing as much outdoors as possible is such an important point in terms of what we're learning about this virus. And of course, we're reaching a season where lots more becomes possible in that regard as well. So, if we were in October again, still looking at the numbers that I had presented to you, it would be a much more concerning position than it is now. So, as we're going into spring and summer and there's scope to do lots more outdoors, just so many benefits of that. And also the virus isn't going to do as well in the good weather, in the UV light, and in the outdoors. So we've got real opportunity to undertake, some more activities in that way, which I think feels really positive. So that's great.
Thank you both. Hopefully we'll be able to retain those special events. They're always my favourite anyway. So perhaps just in a different way.
Hear about your favourite Halloween costume, Stephanie.
Exactly. Could I please now invite Annette Beaton? She's got a question to ask Simon.
Hi Simon, this is a question from Fiona Ferguson from Dalmuir Early Learning and Childcare Centre. And she's asking if there are any plans to remove bubbles within the early years. And if so, when will this be? And also, do children need to remain in bubbles of 33?
Thanks, Net. So I think it's again a really good question, and I think it kind of follows on well from the answer that Carol and Elizabeth just gave to the previous question. From our point of view, in terms of the mitigations that are in place in the guidance, we are obviously keen that as early as possible we get back to a position of working as near to normal as possible as we can for everybody's benefit. But I think at this point in time we don't have expectations that we will be removing mitigations out of the guidance in the immediate future. I think what's really important is that we continue to be cautious. We take advice from the advisory group and from experts about this, and think about when is the right time to look at reducing mitigations and what that might look like. But I don't think that's going to be something that we're going to see happening in the immediate future. And that's for everybody's benefit. We don't want to be at any point going backwards and having to add things back in. In terms of remaining in bubbles of 33 outdoor, what we're asking in the guidance is that settings look to limit interactions for children, and that's about limiting interaction between staff and children, limiting interaction with children, and it's about reducing the number of contacts that people have. That's both from the point of view of controlling opportunities for transmission, but also in terms of the impact if there is a positive case on test and protect and the
Oh, we perhaps lost connection with Simon there.
I think what Simon was going to say was around, minimising how many people need to isolate. So, one of the key things about the bubbles is that, the smaller the bubbles you can maintain when there is a case, that limits how many children and staff need to self-isolate. So from the public health point of view, that's one of the key reasons for the bubbles still being really important at the moment. But Simon seems to have frozen. I think he probably nearly finished. That felt like he covered most of that, Stephanie.
Yeah, thank you, Diane, for picking that up. Hopefully Simon will come back to us shortly. I'd just like to welcome Dr. David Caesar onto the call. Dave is only here with us for a short amount of time, so we're going to swap the order of the questions to some of the clinical questions that Dave is hopefully going to help us out with. So if I move on slightly, can I please invite David Burgess to ask a question on behalf of Lee McKenzie, please?
Hi, Steph. So the question, on behalf of Lee McKenzie, who's from Dunscore Preschool, as the manager. Other than the current measures of hand hygiene and hands cleaning, mask wearing, social distancing, communication with parents and staff training, what else can we do to avoid a COVID outbreak?
Well, great question. So you've covered most of the bases there, and as I've literally just joined, so sorry I'm late, and afternoon everyone. As Elizabeth was saying, and possibly others have said already, that there are a couple of other things that would help. First thing is, we know that UV is protective, so being outdoors more is protective, not just for COVID, but for many other things, actually, other than the weather, but the weather is sometimes good for us. So being outdoors helps from a UV perspective and from a ventilation perspective. So air changes are really important. So being able to ensure the air is circulating if you have to be indoors, but if you're able to maximize that, and I know that that's an easier sell on a balmy February weekend than it is on a slightly dreich October. But with spring in the air, that would be something that we should really be encouraging. And of course, physical exercise as part of that, as a sort of a side effect of that, is of course what we should all be doing more of anyway, especially the younger we are. So that's one thing. Hand hygiene is really crucial, sometimes is getting forgotten. So the habits that we all started with, how many times are we singing happy birthday these days as we're washing our hands? Probably not nearly as many times as we were this time last year. With hand hygiene and surface hygiene is the other thing. So just having those routines in place that enable surfaces to be clean. I know when my 5-year-old sneezes, it's amazing how far such a little person can make things fly. It's about making sure that we are, wiping down regularly and often as much as we can, and sometimes getting the kids outside helps to do that. All of the other things, are still as unfortunately it's the same recipe as it always has been. It's about sustaining it. It's about still making it fun. It's about making sure that it's routine, that we don't erode the discipline that we need to have about that. These are all the things that will make it possible. And really, to do that while we get the proportion of the population vaccinated all the time. We're just trying. It really is in sight. We're not there yet. But if we can keep the discipline and our habits that we're forming around this, it will not only get us to the point where we've got a sizable proportion of the population vaccinated, but we'll also limit the amount of people that will get sick in the autumn when flu might be a thing. So we've hardly seen any flu this year because our if you like, our respiratory hygiene has been so good. Now we wouldn't have chosen it this way round, but it's there are other benefits to it. So you've got most of it. It's just about sustaining it and keeping it in practice.
Steph, if I could just add to that, from the kind of intelligence we've had from the local health protection teams when there've been outbreaks in ELC settings, some of the things that have come up have been things like kettle handles. Do our kettle handles clean between? It's simple things like that. Or if people are sharing a keyboard because they've got to enter information about the kids, is the keyboard getting a wipe over in between use? So it really is things as basic as that just need to be remembered, because it really is in the ELC setting. It really is adult to adult transmission that is the real thing that we need to really take care of.
Thank you, Simon. Do you want to come in there?
Yeah, just very briefly to say that the guidance that was updated a couple of weeks ago, when we did that, we went through this conversation with some of the people on this call and some of the advisors that we have to say that what is it that we need to put in place, and the very strong message we're getting is that it's these basic things that are in the guidance: hand hygiene, using masks, maximising use of outdoors, thinking about ventilation, but also really importantly, risk assessing your setting, applying these measures to your setting, and working with your staff to make sure that everyone really understands it. And doubling down, I suppose, what David was talking about in terms of people have been at this for a while, and making sure that we don't run into kind of COVID fatigue, if you like, in terms of these mitigations, and that really emphasising the need for everybody to have a culture of putting these things in place. It's about doing those basics really well, and that's the advice that we were getting from the scientists here.
Thank you, Simon.
And of course, not coming in if you've got any symptoms.
Great. Now, there's some really important points there, just to kind of summarise about the use of outdoors, ventilation and fresh air, and surface hygiene. Actually reminded me of a quote from the previous Big Blether, where if you've touched it, we've cleaned it, was the tagline. So I think quite a few people like that, so we might want to continue that tagline. Thank you for that. We'll move on then to Annette's going to come back with a question from Margaret Reid, and again that is for Dave. Thanks, Annette.
Thanks, Stephanie. This is a question from Margaret Reid, who's a Child Development Officer, and certainly Carol covered off some of this in her presentation at the beginning, but for people who weren't in at the beginning, it's worth having a revisit. When will staff within education receive the vaccine, and what will happen to workers who do not wish to comply to be tested or vaccinated?
Well, I can answer the first one relatively straightforwardly, which is that we're really in the phase now Well, we're sort of in a transition phase in terms of vaccination. So we have covered the vast majority, but not all the people that are likely to have very serious, and I mean that from a clinical perspective, very serious outcomes. So very severe, very severe illness and death in the vaccination program. And we've got remarkable coverage of the population, much higher than many other vaccination programs that we would normally have. And we're now into the phase where there is still a proportion of people that are being admitted to hospital with severe illness that we are now in the phase of vaccinating through till kind of mid-April and then beyond into the summer. And the quicker, but the numbers are starting to, if you like, balloon. So the numbers of people that are now involved in these greater kind of groups, in the sort of working age groups, 60s, 50s, 40s, are large, are massive. And within that, there are some people that will be slightly more at risk, and we know who those people are, and we're trying to call them in as quickly as possible. But by and large, the quickest way to get whole populations of people vaccinated is to do it by age. So we know that age is still the single best determinant of whether you get a very significant severe illness, not whether you catch COVID, but whether you get a significant illness from it, and unfortunately might die. So age is still the single best predictor, and also allows us to call loads of people in, and we have the capability in Scotland to be doing kind of in the region of 400,000 vaccinations a week. So we have the infrastructure. If we have the vaccine, we can get through these groups very rapidly, but we wouldn't be able to get through them that rapidly if we had to call people individually, in sequence according to your individual risk profile. It just wouldn't be possible. And there's lots of complexity around that. So the quickest way to get everyone vaccinated, and the mission is still to vaccinate every adult. So that's what we're aiming for. It's not to vaccinate every 50-year-old, it's to vaccinate everyone. So the quickest way to get to that endpoint is to do it on a sort of an age-based approach. That's the advice from the JCVI, which you've heard lots about in the last few months. That's the advice that we are going to be following, and largely to get to that mission, if you like, to achieve that mission as quickly as possible. And we think we're pretty well set up to do it in Scotland. We've got a good data capture platform, we've got the infrastructure, we've got the workforce. We need the vaccine to come reliably, and if we do all that, we should get through pretty much as quickly as, other than Israel, pretty much as quickly as anywhere else, if not quicker than anywhere else in the world, which is pretty phenomenal when you think about it. But it's going to be in that order. In terms of whether people refuse to take it, refuse to have the vaccine, so there are some people that won't want the vaccine. Now we're trying to make sure that we are giving all of the best information about why the vaccine is the best thing for you, and it is the single best protective measure that we can take as an individual, but especially as a population. But there will be some people that won't want it. We're trying to make sure that our communication around that is as clear as possible, is as accessible as possible to folk whose English might not be either great, or it might not be their first language, or they might struggle to understand some of the terminology. We're trying to improve that all the time, and also to make sure that that message is being given by people that don't look or sound like me, who might look and sound like the people that need to hear it. So that's really important as well. So we're trying to do as much as we can to give people the best informed choice, to make the best choice for them and for the country. Now, there will still be people that won't want the vaccine. We've been through this in health and social care settings, and there is some call to sort of be a bit militant about it, but we don't think that that is consistent with our values as a society. This is a treatment. People still have the choice of course, about whether they take that, to be appropriately consented, to have the right information, then to make the best judgment that they see for themselves. It's not what we would hope for, but we've got to respect what is, in our experience to date, a very, very small proportion of people that might make that choice. There are some, we have some, if you like, regulations around testing in some settings that make that there's less choice around that, or there are more punitive kind of consequences in some settings around that. But by and large, we are appealing to people's, I suppose, rational sense of their own well-being and that of the community in which they live, and trying to make sure that we are doing all we can to give the right information for people to make that best choice for themselves.
Thank you very much. I apologise for the constant stream of questions directed towards yourself, but we realise we only have you for a short time. So I do have one more specifically for you, and that is that the current advice is to work from home. When are people who are shielding likely to be able to return to work?
So the shielding advice, the population formerly known as people who shield, it hasn't really changed. So it's still going to be, if you like, aligned to the levels approach, which those who have been shielding know all about what that means. There is still the opportunity to have an individual risk assessment with your employer, or in your specific circumstances, to see if there are any ways that we can that a safe return to work could be managed, or different working conditions could be manufactured to help people that might be in the shielding population. But essentially, we're trying to get to the point where we get back into that levels approach, which will then allow that sort of more nuanced approach to those that are shielding just now to I was going to say reintegrate with society, but it'll feel like that. And of course, in that time, we will have vaccinated more and more and more people. Now, most of the people that are clinically extremely vulnerable should have already been invited for vaccination. And of course, we just need to remember that having one vaccine is very protective, but not immediately. So there's a lag to that effect of 3, sometimes 4 weeks. Not everyone will have a vaccine effect. We know that it's not 100% effective, but this is also one of the reasons for us to be cautious, to be understanding what the effect of some of the very light lifting of restrictions, especially around young people, what those effects are, so that we can understand how we then move back into that levels type approach. So that's really the sequence that we're looking towards.
Steph, if I could add on that, so there are particular studies happening at the moment now that quite a lot of the formerly shielded have been vaccinated. We obviously need to give them a bit of time for that vaccine to have an effect, but there are studies ongoing across the UK to look at how effective the vaccine is in the extremely clinically vulnerable groups. And once we have that evidence, that will inform how quickly we can open things up for shielded.
Thank you. You could perhaps give you both a break there, and I'll take in.
Steph, just there is a question from Ms. Brunella about the change in shielding advice, which might just be important just to pick that up. So, as Diane kind of alluded to, we're actually learning all the time about some of how this disease kind of manifests and who might be at risk. So that evidence is evolving all the time. There are also some tools that are being used that are able to take that evidence and then build it into relatively complicated algorithms, which use your previous medical histories and the data around all that and put it all together and create a risk profile. Now, those risk profiles are altering a little bit at the edges. So most people who are clinically extremely vulnerable right at the sort of beginning of the pandemic are still the same. They're still the same people, but there are some additional people that are being added to that list because of an accumulation of different risk factors that are being worked through by some of the new evidence. So that's why some people that weren't deemed as extremely vulnerable before have now been deemed extremely vulnerable now, and it's at the edge, but we want to make sure that we are capturing all of that as best we can. So that's why those populations slightly change, and of course we're all a year older, which will have an impact as well.
Thank you. I'm going to pull in a few comments from the chat pane before we move on so that we don't lose them. One of the comments actually from Miss Brunella as well was around kind of advice when dealing with parents. So perhaps parents might not be as stringent in following the sort of lockdown rules as they might be encouraged to be, allowing sort of children for sleepovers or having sort of cups of tea with other parents and carers when the nursery is on. So has any of the panel got any advice that early learning and childcare establishments could provide to parents and carers? Elizabeth, do you want to come in?
Yeah, Stephanie. I certainly saw the comment in the chat about, I don't know whether it was from Ms. Brunella or not, about whether the council has got very good risk assessments in place, but unfortunately some parents are choosing to disregard that and allowing sleepovers and going to their friend's house for a cuppa. I think that, you know, as a Scottish Government, we've been very, very clear that that runs a risk of letting the suppression increase or not be suppressed and letting the prevalence increase, and that will give us, you know, enormous problems. And I think that we've been very clear that the priority is very much education, but to enable education to reopen and pupils to get back to school, that all these mitigations need to be in place, and that includes not having the sleepovers, not going to meet friends, not meeting at the gates of the early learning and childcare centre or meeting at the gates of school, with no face coverings, close proximity, and having a chat. And we would all love to do that. Anyone that knows me knows that I just love to chat, but I certainly am going to be standing close to anybody in the near future to do that, because it's just too important. And I think what we know from schools and early learning and childcare setting is that many of them have got very good relationships with their parents. And it's maybe a case of actually explaining to the parents what the risks of doing that are. And it's risks to themselves, and it's also risks that actually the virus could start spiraling again. And actually that then means that the establishment could close. And, you know, that could happen in a locality, so it's the individual establishment, or it could happen on a more national situation. And that's absolutely the last thing that any of us want to happen, that we're getting some children back to school. And it's been absolutely joyous to see some of these small faces as they go back to school, and the more we can get of that. And it's maybe a case of actually explaining to the parent. And we know that schools are very, very good at that. And I think it is explaining the risks to parents and hope that they actually listen. And as I say, we know that schools are very good at doing that, and early learning and childcare are very good at doing that.
Thank you, Elizabeth. There is another sort of extension to the previous question about the involvement of parents and families, and that is with the transition process. So what will establishments do when children and families have to be involved in transition visits to the school? So I don't know if there's anything else you want to add on that note, Elizabeth, or any other panel members.
I think the transition process, like everything else that we've had over this past year, is going to be very, very different. And I think what I've certainly seen some establishments doing is videos which can be shared, so that the video is made by primary 1 pupils, for example, and then it's shared with nursery children, so they can actually get a real sense of what to expect. And I think that somebody said we've seen some fantastic transition videos from schools in ALC settings. Absolutely. And the more that we can do that, and the more that, you know, we can use Teams. And I've seen some very small children being very adept at using Teams to have conversations. So you have a pupil in the primary school having a conversation with the pupil in the early learning and childcare establishment so that they can ask questions. So I know it's maybe not the same, but actually I think many of these children have been brought up using technology and have been brought up speaking to grandparents, aunties and uncles, using the technology, using whether it's Teams, FaceTime or whatever. And I think they're just much more adept and used to it than perhaps certainly I was when I was suddenly faced with using Teams or Zoom or something. So I think there are lots of other things that can be done in a different way, and it's a wee bit about thinking creatively, and that's what we've seen. And I'm sure Education Scotland are going to be sharing some of these ideas.
Brilliant, thank you, Elizabeth. There are a few questions about the lateral flow testing, so hopefully they'll be covered in our next question, which is from Claire Hay. Would you like to unmute your mic and ask your question, please?
Hi there. Why has there been a difference in testing provision between private nurseries and standalone centres which currently aren't being tested and nurseries attached to schools which are? And are there any plans for this to change?
So we'll go to Simon on that one, please.
Thank you for that one. Well, I'll take the second part of that first. Yes, there are plans for this to change. We are working towards expanding the at-home testing route to everybody working in childcare. And that's because we recognise that, first of all, everyone working in childcare is exposed to the same situations and we should be treated the same fundamentally, and that it's an important tool for reassuring people and helping people feel confident in terms of going back to work. A couple of things to kind of say on that. One is, at the moment, all staff in ELC and childcare settings, including childminders, can access asymptomatic testing if they want to at any time by going through the portal, and you can go down and get a swab test and it will be turned around within 48 hours. We have ELC and school-age childcare staff working with daycare children attached to primary schools are being offered twice weekly at the moment at home asymptomatic testing through the lateral flow test, the lateral flow devices route, and that will be being rolled out to all childcare establishments over the next wee while. We're working through the logistics of that, and part of why is this not on offer at the moment is fundamentally logistics. This capability that we've had to provide this testing route to people has come in, as all things are at the moment with coronavirus, very quickly. And there are very strong and very direct routes to get things like this into schools through local authorities quickly. When we're looking at the ELC sector as a whole, we've got a whole range of settings ranging from local authority settings to larger change to very small independent settings, and that is just more complicated to make that happen. But we are working towards that as quickly as is practically possible. There's a data collection exercise underway at the moment, and all settings should have received communications about how this testing is going to operate. There were provider notices at the end of last week to all providers in the country. So if you haven't had that information, get in touch with your local authority, get in touch with us, and we'll be able to share that on. But fundamentally, yes, this will be available to everybody. But it's important to say, if anyone's concerned at this point in time, you can access asymptomatic testing at any time.
Thank you, Simon. Would anyone else from the panel like to come in on that one? No. Okay, before we move on to one of our other questions, there's a comment in the chat pane that's probably quite important to bring in. Jackie Leith, I know you mentioned it a couple of minutes ago, so apologies for the delay, but do you want to unmute your mic and make your point there?
Hi, yeah, sorry. I just wanted to bring in about the split placements. You know, obviously we're keeping our bubbles as low as we can be so that everyone's safe, but then we allow split placements where, you know, it could be a child from our childminder or it could be from a bigger establishment. And I just wanted to know what the thoughts were about that. Thank you.
Who would like to take that one?
I'll let Simon come in first, and then I'll maybe add to it. But yes, we've had a lot of discussion about this one. So
we have had a lot.
First.
We have had a lot of discussion about this one, and I think it's important to say two things at the beginning. One is the guidance, which was put in place last year, and it was re-emphasised just recently, is that we should ideally be working towards encouraging and supporting families to work within one setting only, ideally, and I think that's the language in the guidance, ideally in one setting. We also have put in the guidance a requirement that all blended placements are risk assessed, and that should only be taken forward where it's agreed jointly that this is the right thing to do to meet childcare need or to provide high quality access to high quality childcare. I think the point here, and Carol can talk about the views that have been given by the subgroup on this, is that there are some people who need split placements for a variety of reasons. Some of those are to do with working patterns. There are essential workers who don't work hours that would be conducive to being in one setting only if that setting closes at a particular time. And also there are some children who have real needs that need to be considered in terms of access. We also know that the number of blended placements is very small. We have direct data on the number of placements that are provided through the funded ELC offer. It's very small. We also have some data on the number of placements that are provided that are taken in unfunded, although obviously we've got a little bit less visibility of that, but we do get information on it. And we know that that number's dropped since last summer when these additional guidances came in, and people have made a choice and said that we don't need to send a child to do different settings. And I say personally, I've made that choice. My son used to go to 2 nurseries, he now goes to 1. So it's about trying to recognise that there are places where people need this, and that people need to have a conversation together with providers and parents to say, why are we doing this, and is it the right thing to do, and how do we risk assess that? And I think that's quite important. But Carol may want to give comments from the subgroup's point of view.
Thanks, Simon. No, that's absolutely right. I think one thing maybe I should have covered earlier was just to say a bit about how in Scottish Government we're considering what we call the 4 harms. So we talk about these 4 harms. The first harm being the absolute direct harm from COVID-19. Second harm being the wider health and wellbeing harms, including the pressure on the NHS and the implications for the provision of other sorts of healthcare that's required. The third harm is what we call the social harm, and that includes issues like child protection, education and learning loss, sense of isolation and loneliness, people's own sort of fears in and around the virus, all those sorts of things that you might see as psychosocial factors. And the fourth harm is the economic harm, the harms to business from the lockdowns and the restrictions that are in place. So in all of the policy decisions, what we call a 4 harms assessment is done, which looks at a range of policies across all of these 4 harms. Now, they're not. It's not a case of trying to balance the harms. It's absolutely clear that in order to minimise, for example, economic harm, we really need to suppress the virus to the lowest possible level. So it's not a case of saying we'll have a bit of this harm and a bit less of that harm or whatever. I mean, it's absolutely driven by an approach which is aiming to get the virus suppressed to the lowest possible level. But that isn't to the exclusion of all else. So as Simon said, when we looked at this, I mean, you're absolutely right. If our only concern was to absolutely, minimise the spread of the virus, you would say there should be no blended placements. But when you look at the realities of people's life, the importance of keeping key workers able to work, the importance of protecting children who might otherwise be vulnerable if they didn't have a blended placement, we felt that it was reasonable to say that in those sorts of circumstances, subject to a conversation with the family and appropriate risk assessment, that those sorts of blended placements should go ahead. So that's the rationale for that. But they should be kept to a minimum. They certainly shouldn't be kind of encouraged for people just because it's a bit more convenient. Thanks.
Thank you both for clearing that up for us. Our Education Scotland colleagues have actually posted links to the transition resources in the chat pane, so hopefully people can have a look at some of the effective practice exemplified in there. Kind of leading on from kind of the voice of young people and the well-being of young people, I'd like to invite Moira Leslie to ask her question to Simon and Elizabeth.
Good afternoon. My question is, what advice and guidance is available to support professionals to gather the views of young children in relation to their emotional well-being directly from the children themselves, as opposed to through the lenses of parents or professionals? Thank you.
Will I go first, Simon? Okay, thank you. I think what you're hitting on there is something that's really key, is about the importance of asking children and young people how they're feeling and what they think. And I think that we've found this hard. And I know that, for example, we have recently had a young person join the Education Recovery Group. And I know that that's obviously a much older young person than you're talking about here. But I think that having a young person has made all of us think, and he has proved himself to be very insightful about some of the challenges which are facing young people in terms of their well-being. And I think very often his comments actually make all of us just stop and reflect on what we're doing. So I think your question about gathering the views of young children, and again, it's about talking to them very often. It's about actually taking the time to talk to them, to gather their views and gather their feelings. And again, it's about, I'm watching some of these emojis which are appearing in the chat bar, and it's about young children who are very adept at using things like laptops, whiteboards. I've seen some fantastic work in my time with very small children using big whiteboards, either as a tabular form of whiteboard or on the wall, and actually then it's using the emojis to actually seek their views. So it's about using all of these resources that are available to us to actually check in. And I think one of the important things with looking at the return of children to school, it's about the importance of checking in with children and young people to find out how they are feeling. And I think that the current state of the epidemic and where we've been, I think for all of us, whether it's very young children or whether it's staff, it's that important of doing that check-in with our peers and checking in with children. And that was one of the things with the subgroup that we were really keen to actually promote and encourage, was that concept of re-engaging and re-establishing relationships with children and young people. And it is, I'm watching some of the comments in the chat coming in, and it is about actually listening to what they're saying. Sometimes we can hear the words, but do we actually listen to what they're actually saying to us? So I think all of these things and some of these lovely examples about children painting, drawing, acting out through pretend play are all ways in which we can do that.
Thanks, Liz. I'll just add a couple of things to that, just to say, well, first of all, I'm not a practitioner, so I always feel nervous talking about this kind of thing to a virtual room full of practitioners. But I suppose a couple of points we would say is that all children here are going to be different and are going to be affected by their experiences of this in different ways. And I think what's really important here is the relationships between practitioners and children and the key workers and the nurture that goes into the work that you do in early learning and childcare. I don't think there's going to be one set of resources that is going to be available that's going to kind of collect that together. I think it's the professional skills of the early learning and childcare workforce that enable people to identify what different children need at different points, and then choose the right tools to engage with that child. And I think the stuff that's coming through in the chat about what types of activities you would do with children is really valuable, and that expertise resides in the people on this call and in the people who are working in settings. There are some things that we'll be putting out over the next few while, building on some of the links that were put in the chat. There's a note coming out from Scottish Government tomorrow just with pulling together different types of resources that might be relevant, so we'll circulate that around. And there's also, where it's appropriate, tying in with other professionals about children who have, more who are experiencing difficulties in all kinds of different ways. But what I think this is a slightly extreme situation, but the core skills that professionals have in identifying children's needs and understanding individual children's needs is really what takes children through this, and that nurture and strong relationships is what takes children through this as well. And that's one of the reasons, frankly, why we're so keen to have children back in ELC in a managed and safe way.
Thank you, Simon. We are lucky to have our Education Scotland colleague Lynn Taylor on the call, who was closely involved in the Realising the Ambition work. And Lynn has posted a comment that's resonated with a lot of people. So just to invite Lynn to share some of her thoughts on this as well, please.
Yeah, thanks, Steph. Can you hear me? Just really briefly, that national practice guidance encourages and almost has that template about really listening to young children's voices. And what we need to understand is for very young children, their voices are expressed through much more than what they just say. We look for their actions and their emotions and their words to have that complete picture about how they are and where they are. And we encourage everyone to kind of think of that, bigger picture. It's not just sitting children down and kind of asking them how they feel. It's really observing where they are in that moment. Even a very verbal young child still expresses so much through their actions and emotions. So just to refer you back to Realising the Ambition for that.
Thank you, Lynn. And we've had a few people in total agreement. So we've got Sue who's saying children can paint and draw too and act out feelings through pretend play, and Moira making the point there to really listen, not just to speak to them, but to what they're really saying to us, so other communication means as well. Now we are moving into our final discussion point, so I would just encourage anyone who has any other comments or questions to pop them in the chat pane and we can bring them in. But we're now sort of moving from the learners and young people's wellbeing towards health and wellbeing of staff. So if I could invite David to ask a question on behalf of Fiona Keating, please.
Thanks, Steph. So the question from Fiona is, how do we manage health and wellbeing for staff when the team spend all their hours working with children? How can we best support our teams?
And Elizabeth, that one was for you, if you want to start us off.
Thanks very much. And I think in some ways this is very similar to what I was saying earlier about that importance of that check-in and the importance of actually talking to the staff, but not just talking to them, but actually hearing what they say back. So it's a bit more than it's the active listening, it's the really listening to what they're saying and how they're feeling, because there's no doubt that each and every one of us in our own way has found this pandemic really, really hard, and it's different ways. We have to remember that some individuals will have been bereaved, some will know people that have lost lives, sadly, and even if we're not in that position, the whole impact on having schools closed, having some of our lives disrupted, in ways that none of us, I'm sure, sitting here a year ago could possibly imagine. And it is that importance about finding time to actually speak to staff. And it's about that caring relationship that a manager has for the staff that work for them. But it's also about the peer relationships that we all have and actually taking that forward. And again, it's always quite distracting when you're seeing some really good things being posted in the chat. And it is about the sort of whole well-being. And I know that when we were on one of these calls last week, Education Scotland actually mentioned what was actually being done in terms of supporting staff and well-being, because it's such an important area. So I don't know whether somebody can speak about that.
Yeah, thank you, Elizabeth. I know that, Dave, I know your time's quite limited, so there was a point made there that sort of NHS have been involved in a lot of staff wellbeing work, so I don't know if you want to come in with that first.
Yeah, sure. That's why I was a bit late, actually. I was just on a call about exactly that. As Elizabeth absolutely rightly says, it doesn't matter where you work or what you do or how where you were before. I mean, no part of society has been untouched. Although we are all experiencing this differently, and we know that certainly some of the early evidence from health and social care settings, I imagine it translates pretty well, is that whilst physical health has been affected most severely at the older age spectrum, actually younger, especially folk with caring responsibilities, especially those from ethnic minority backgrounds and often women, are probably more profoundly affected from the mental or emotional health aspects of the pandemic. There's a kind of duality to the harms, and as Carol was saying, of course, the voices we hear the least are those of young people as well, who will be carrying some harm in all of this as well. So there is a long legacy to all of this, and in the short term, we've been working pretty hard to try and support staff right across the spectrum of health and social care. So it doesn't even matter if you are paid. There should be something for you if you are a carer, and we've tried to make that as inclusive as possible. But fundamentally, it's a bit like the what stops you getting infected. The recipe is actually quite straightforward. It's just really hard to do. So in the most part, if you are we have this term that if you're morally injured, so if you have moral trauma, which is really what we're talking about, that tends to come a little bit after all the excitement of a massive incident. This is in health and social care settings, so it tends to be a bit of a delay to feeling bad. So that can sometimes feel weird for people, which is that, well, the excitement's gone, or the effect is gone, and now I feel like I'm breaking down, kind of thing. So that's a thing to be recognized. So it's really important to check in with staff right beyond, for the long term, to make sure that people are well emotionally. They may be carrying stuff now that is easy to sort of handle, but might become an effect later. So you should keep that dialogue open, make sure those relationships are good. And part of the way of doing that is making sure that you create space and time to what we would call debrief, but essentially connect with people and be able to do that safely, so psychologically safely, in a way that suits you as a group, as a team, to be able to do that with your peers. So that's something that, for example, Scottish Government can't. We could write a policy about that, but that's likely to be slightly sort of dry and probably not do the thing that it needs to do. But there's something about, if you're an employer or if you're a line manager or if you're a team member or something, just making sure that you understand the importance of the habit of check-ins, of debriefing, of creating social as well as professional space virtually at the moment, but making sure that you create those connection points in a COVID world. So with all of that, but making sure that you create the space for those things to happen. And 85–90% of people that are involved in, for example, the Paris bombings or the London bombings or the Manchester Arena attack, even in very, very traumatic instances, 85–90% of that can be dealt with through social means, through normal social interactions, which of course we are all lacking at the moment. So there's something about actually being effortful in sort of recreating those. And some might need additional support. So I know that education colleagues have been looking at what that additional support looks like. And of course, all the normal mental health support routes are open through NHS Inform, through the Mental Health Hub, All of these things are available still. So yes, there's a lot of work going on in health and social care settings. There will be a long tail to this, and of course, it makes the centrality of well-being as a mission, that being central to how we view each other and ourselves, whether that's in formal health and social care services, but actually it's much broader than that. So more broadly, how we put that front and center, as someone put in the chat, you can't be an effective human if you're not well emotionally, mentally, spiritually, and physically. So how do we have that holistic approach to everything that we do going forward? And that's part of our work going forward. Carol and I and others, we're trying to make that the conversation that sustains going forward.
Great, thank you. And I can't see your first name, Solly, so it's Mrs. Townsend. Solly's put a really important point in there, just agreeing with what you're saying, that yes, we've got lots of information and lots of external support for health and wellbeing, but ensuring that it's weaved into the daily practices of people and it's not always kept in staff's own time, that's a kind of time and space to address wellbeing. It is brought to the forefront, like you were saying. Now, there are a lot of links in the chat there about different places where support can be offered. Please don't worry, we will get them to you after the call. One that has come up, though, that I feel we should kind of address is the work from Education Scotland and other partners around a national offer of support for the workforce. So I'm going to bring in my colleague David Burgess to give us a little bit more information on that. Thanks, David.
Thanks, Steph. Dave covered so much because there's so many similarities in terms of the work that Dave's talking about and the Scottish Government funding, which falls under Workstream 6. And so basically that's about workforce support. So there was funding from the Scottish Government, and that funding has been focused on health and wellbeing, but we're working with providers. So Barnardo's in Place to Be, and the focus around that has been around coaching and mentoring, but also almost in terms of supervision, so awareness of the challenges that practitioners and leaders will face with the return to school buildings, as it was back in August. That's continuing at the moment, so there's still links in the chat pane to the work from Place to Be, and it's taken different forms, and it is about that mental wellness. So it's about creating safe spaces for people to come, to share, to debrief, to offload. These are available in the link in the chat pane there. So there's work by Barnardo's, which is looking at health and wellbeing across that kind of mental health and wellbeing across clusters and taking slightly different approaches to be a sustainable kind of network approach. Place to Think, Place to Be, they are offering webinar sessions around kind of key focus areas, but they're also looking at bringing groups together to explore, and there's also one-to-one coaching as well. Now, initially that was aimed at school leaders, but that has been widened to those who are new in post. It's also been widened for those who have got child protection as well. And there's spaces being held around what we found in terms of feedback is about people are looking for that. And so the aim will be to evaluate the success of that and to look at widening that offer to cover lots of different groups within the workforce. So that's been looked at and evaluated as an evaluation group, which is looking at that. And we're hoping that that funding would continue and we can look at how we maintain and actually widen that support further. So all the information's in the chat pane within there. We've also put in links to resources in Education Scotland Professional Learning website, where there are links to different resources that might be useful for colleagues. But I think what we're seeing in the chat is that there's lots of resources. I think part of the challenge for colleagues in the call is actually getting staff together to have those conversations and kind of take that forward.
Thank you, David. I'm just noting some comments in the chat there around having space and time to talk and kind of the craving of human contact. So it's also worth noting that, and my colleague Shan, I think, has posted it in the chat there, there is a wellbeing discussion for early learning and child care colleagues on Twitter. So if you would like to get involved in that, it is on Wednesday and Thursday this week. So the information is there if you want to have another chance to come together for discussions. That really takes us to the end of our questions. I can't see anything else in the chat pane. Do any of the panel want to make any final comments before we finish up?
Thanks, Stephanie. Well, final comments. I mean, I think just primarily a huge thanks to everyone on the call and to everyone in the early learning childcare sector who have been just doing incredible work and responding to these various requirements in terms of mitigations and keeping the sector safe. So huge thanks for that. I've been reflecting a lot on that last discussion about well-being, which feels incredibly important and not the sort of discussion that's easily dealt with in a kind of question and answer sort of format, because these are really kind of deep and challenging issues. But there's no doubt we're still in a marathon here. And even once we get the epidemic, suppressed to low levels, there's going to then be all sorts of different demands on services and so on. So just, I guess, a plea to us all to recognise that there's still, quite a long way to go in this marathon, and not to try to sprint it, but to create enough time for sort of personal recovery as well as we go through. But it's been great to be part of this, and we're here, and we'll pick up what's in the chat bar, and if there's anything else we should be thinking about, please let us know. Thanks.
Thanks, Carol. Just before I pass to Simon to officially kind of close us off, there is a very short evaluation form in the chat pane we would really appreciate if you could complete. Obviously, we are inviting as much feedback as possible, and we need to know your views in order to get the support required. So please take the time to fill that in. And I'll pass to Simon. Thanks, everyone.
That's great. Thank you very much, Stephanie. And I think really just to kind of close the session off, thanks yet again for everyone participating in the way that you have. It's fantastic that you've come along, you've asked the questions, you've put the challenge to the panel. Can I thank each and every one of our panel, Carol, Diane, Simon, Elizabeth and Dave for being here this afternoon. It's great that you're able to make the time to have this conversation. It's one that we want to make sure people are getting access to. There is clearly an awful lot of information out there. One of the things that I've put in the chat bar and the rest is the campaign that we ran saying don't stay on mute. Clearly, we all need to reach out. We need to engage with each other. It's not just a reference to using Teams, although it's a daily frustration. So we would ask you all to make sure that you make use of all of the information that's available. Pass it on to those colleagues that couldn't attend today. Really conscious that there are tens of thousands of you out there working every day with children and young people, making these services happen, which are vitally important to the health and well-being of Scotland as we move forward. So please do make sure these messages get passed on. We'll make sure after this, not only you get the evaluation and all feedback welcomed, and we'll also make sure you get all the links that have been put into the chat. Can I just on that basis, thanks again to our panel and thank you to you for coming along, and we look forward to having our next session again on Friday with another group of people. So if there's anyone that you know that would welcome to be part of the sessions, please let them know that it's happening. Okay.
Thanks, folks. Bye.
Bye.
Bye.